Officials with Norwest Community Health Centres have issued a substance warning for street drug users in Thunder Bay. Norwest has special equipment at its Safe Supply program that can't analyze drug samples to see what they truly contain. Norwest Director of Health Services Jennifer Lawrence says what they found last month was startling, especially with samples of what users thought was cocaine.
We definitely saw a very concerning trend in January where the majority of the cocaine samples checked didn't contain any cocaine at all. In fact, over 10% of those samples contained fentanyl or fentanyl only, and 55% of what was thought to be cocaine that was checked that didn't contain any cocaine. Many of those samples had fentanyl in them.
The substance warning was issued this week on Norwest's social media pages. Only 15% of all drugs tested and just 11% of supposed cocaine samples were found to be the actual drug people thought they were buying. Lawrence says this is especially concerning for recreational cocaine users who wouldn't normally have naloxone on hand to prevent an overdose because naloxone only works with opioids. She's recommending people start carrying naloxone and also use the Lifeguard app when they ingest any type of street drugs.
So I think it's really important to remember that the drug supply is very toxic and very variable, that you might not be getting what you think you've purchased, and that in fact you may need to be prepared to respond to an opioid overdose even if you don't think you've purchased an opioid. So making sure that you're not using alone, that you've got naloxone, you know what to do with naloxone, and that so do the people that you're with. And if someone is using alone, to really use that Lifeguard app and set the timer so that some EMS can respond if they do overdose.